Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County branch of the American Association of University Women, one of the civic partners for this show. Today we have Relani Prudhomme and Jeanette Zoeckler in the studio with us today, and we're going to be talking about health and safety issues for young workers. Jeanette is the Director of Research and Special Projects for the Occupational Health and Clinical Center in Syracuse, and Relani is the Education and Outreach Specialist based here in Canton. And so just before we get started, Jeanette, let's just give people a quick thumbnail overview of what the OHCC does, just so folks will understand your role in community health and safety.
Sure. So the Occupational Health Clinical Center is a part of a network of clinics, and this network of clinics diagnoses, treats, and prevents occupational disease. So we actually have doctors and nurse practitioners who are medical care providers who see hurt and sick workers after the fact. We also have a prevention mission, which involves education and outreach, and so that's where my main work is in the city of Syracuse, and Relani is coordinating up here in the North Country.
Okay. Thank you. So local colleges are graduating right now, and high school students will be finishing up in a very few weeks. And many of these young people will be joining the workforce either for the first time on a temporary basis or maybe going out to their first jobs. And for a lot of these young workers and their family, this will be the first work experience. And there are health and safety issues that everybody needs to be concerned about on the job. And if you're young and it's your first job, you don't really know much about what to expect, do you? A few weeks ago, I spotted an ad by the One Stop Career Center in Canton for summer jobs for young people. And some of the jobs they advertised were activity aides, clerical workers, groundskeepers, maintenance workers, summer recreation aides, forestry aides, laborers in highways and golf courses, and nutrition aides. So, Jeanette, these job titles kind of raise some red flags with you, don't they, in terms of health and safety? Can you tell us why?
Well, they certainly do. Every job has a hazard associated with it, actually. All of our jobs, even very simple, straightforward jobs where you think are safe, have potential hazards, but these listed here are among the highest. We're setting young people into jobs with very little training, likely to go into some pretty dangerous situations. Groundskeepers face, all sorts of equipment that they're supposed to be using. They interact with nature, which means they could run into any number of, infestations of bees, for example, or allergens or other situations out in these grounds. Maintenance workers are exposed to chemicals. Often chemicals they don't know what they're using. They're not well labeled or well delineated how we should be using the chemicals for maintaining and cleaning things. Forestry aides, logging is one of the most dangerous occupations. I probably don't have to tell you all up here about that, how dangerous it really is. And so just having a young person around to do extra things, and I'm sure is very helpful, but they're in an environment that's fraught with potential dangers. That equipment is designed to knock down huge trees, and if a person's body gets in the way of that equipment, it's a serious problem, or in the way of the trees as they're being felled. So those are really serious. On highways, we have recently had a big attention given to highway safety because workers are really killed at alarming rates on highways, and it's serious. So now if you have young people out there, we'll talk about why does it matter for them. And then nutrition aides or employing young people inside healthcare settings also has a twofold effect. One is they're developing and they have this exposure to emotionally strong situations, which are not always easy to manage, on top of being exposed to any biological hazards which may be in existence. They're often asked to clean things, and so all of a sudden they're in the maintenance hat when they haven't had that kind of training. So now all of a sudden you find yourself with a young person who doesn't have their full development yet, in a situation where they haven't gotten probably, I mean, we're not going to assume they aren't going to get any training, but the kind of training that a worker would get if they were going to be invested in over the long haul. So they're temporary help. And because of that, we worry that the training isn't going to be adequate to cover the serious conditions that they'll be facing as they work. And one of the most important things about young people, and then I'll stop talking, is that, you know, they are expected to kind of go the extra mile because of their youthful energy. They are expected to push it. It's their turn to pay their dues. And many parents and a family will support that sort of story, that you have to go and work extra hard. And what can happen is, many times our bodies aren't designed to take that extra load, no matter how old we are. And so the young worker wants to please the boss. This is the first, they want to show their work ethic. They want to do what they're asked. They almost run to it. Right? They're running toward the work in a way that, you know, either psychologically or actually physically running. And so they're taking on something that they may not be fully aware of. And they don't have as much ability to speak up because, you know, they're in a position of newness, and that's a lower power position, right? So I'll just give a quick example. My son was working actually for a landscaper, and he arrived, and one of the fork truck drivers, or actually it was some kind of backhoe, large equipment, was drunk. He was inebriated, and now he feels in danger for his life because he's assigned to work with him one-on-one, moving huge boulders around. You know, he's faced with a situation where he's got to go confront the boss, the supervisor, the foreman. These men are looked up to, and he has to now announce, you know, that this person is drunk. Oh, it happens to be that it was the owner's brother. You know,
if it could go wrong, it went wrong.
You know, it's really tough. Now, what happened in that case was finally the owner had it. He sent his brother to rehab, and it all turned out to be good. But in many cases, you may lose your job, right? And so I think it's really tough for young workers to be able to speak up in a situation when they see something they don't feel safe and they're not sure. They haven't been trained in a specific, if you don't feel safe at work, this is what you do when there's an imminent danger. They're not sure what to do. And so many times, unfortunately, you know, accidents happen that have lifelong, lead to lifelong health issues. Right. So it's important to think about these young workers differently than we sometimes do.
Right, and one of the things that we know is that everybody learns by doing, and until something goes wrong, you may not understand what the danger is, and then if you're lucky, you can escape from that danger without any permanent problems. But if you're not lucky, that's not going to happen. And those are just some of the jobs that young people can have. There's other jobs with serious safety concerns. Fast food workers, deli workers, lots of things like that where you're using very dangerous equipment and can have slicing and dicing accidents that are not going to be easy to recover from. So, Relani, as an education and outreach specialist, you provide a lot of community education about issues around health and safety to workers. Can you describe for us some of the kinds of things you do on a routine basis for worker safety in general, and then we'll get more specific into what can be done for young workers in particular?
Sure. I provide workshops like what we had discussed in the other interview about the Low-Wage Workers Health Project and the Know Your Rights type of workshops that involve activities that give people a chance to make the connections between their workplace and their health, understand what their rights are and how to use them, and connect them with resources when they don't feel equipped to deal with a difficult situation. I help to raise awareness with the workers specifically, but also out in the community, doing through cultural kind of activities. For example, years back I coordinated a community mural painting to raise awareness about, and to bring people together on that project. A play, we actually had the Grass River Players, we actually contracted somebody from there to do an original musical, and that really had a focus on workers' health and safety, working in the North Country, and also a film tour, and so projects like that will reach a broader audience that wasn't necessarily coming to the event because they love workers' health and safety, but it's embedded in that more kind of fun cultural experience. I also collaborate with local agencies and some agencies further out that might bringing them and funding for trainings that are needed in the area for health and safety, like the OSHA 10 for construction, for folks at either low cost or no cost to them, and the RRP training, the certification that's needed for renovators and people who do repair on homes with lead-based paint and painting on homes with lead-based paint, to give them that EPA and HUD certified, mandated training that would also protect them as well as the people who live in the home.
We actually did a North Country Matters a couple of years ago on that very subject and
Exactly.
talked about
So-
what some of the hazards are here in St. Lawrence County, where much of the housing stock is very old
Right.
and the renovations have not kept up with some of the safety issues that have been discovered about lead paint since it was used,
Right.
back in the day.
So I'll coordinate to try to get those trainings in place here so that folks can come, and that's nice for employers too, who are responsible for training their workers and getting them certified when they need it. That if they can get their group of workers into one of those classes, that really saves them, like for paying, hundreds of dollars to truck them somewhere else to do it. I also do some collaborating with agencies on special projects. So I'm involved in the North Country Energy Task Force on the Healthy Housing Initiative that they're working on. Just trying to contribute also that you mentioned that, this workers' health is also a part of community health, and there's a real overlap there. And so in the housing initiative, that's, really where that comes to play. Also working with Canton Potsdam Hospital on the Cultural Competency and Health Literacy Committee to further health access, especially for immigrant farm workers who really don't know the system and how to best access it.
And there may
Making
be
sure they
language barriers as well
There
as
definitely are language
understanding barriers.
Absolutely,
yes.
yeah,
Right.
so we're working on that project and other local agencies. So worked on quite a spectrum of different kinds of projects. But very excited to start, this is the first year I'll be doing something with youth specifically.
Right.
Yeah.
So just kind of in general, if an employer or a group of workers wants to set up a training session, how would they contact you? How would they be able to do that? Maybe as we had mentioned before, a group of workers has identified a problem in their workplace. They've gotten permission from their employer to do something about it, and now they're all looking for a way to collaborate to actually address that issue through training.
I wish I seen that happen more often, but I mean, certainly the first starting place there would be probably to call directly to the Syracuse office.
Okay. And we actually will have the link for that on our show notes, so people will know how to get a hold of your office in Syracuse, Jeanette.
So yeah, as the same that a patient would be doing, it would be the same person, the industrial hygienist Greg Sawinski, who would do that intake and assess, what the needs are and make the arrangements with the employer to go in and do that kind of to set up, to figure out what kind of, you're talking about training?
Yeah, if needed.
So
right.
say, I've been setting up trainings in this area, if I'm not available, then they can talk to directly to the Syracuse office, but certainly people call me or they call the One Stop Career Center because we often work in tandem, or with the SUNY Crest Center.
So you've mentioned the Career Center. Let's talk a little bit about what the trainings are that you're going to be doing this spring for workers, because you have set some things up for young workers, haven't you, specifically?
So the One Stop Career Center, along with, I think it's the St. Lawrence County Workforce Development or something along those lines, they are running this summer youth employment program that they have been doing for years, and they have a workers' health and safety component that's a time allotted during an orientation session that will reach about 140 young workers in the program in 4 different locations, in Ogdensburg, in Messina, Governor, and Canton. And this year they're allowing me to come in and do that piece, the orientation. And I feel that I'll be able to give it a little bit more of a specialized touch because, this is what I work on, day in and day out.
Right.
So I'm excited about that. We use NICOSH material that's tried and true and developed really for young people, and that will help, cover some of the hazards, some of the rights, but really some of the extra protections for youth, in terms of what hours they can work and not, and, what equipment they're allowed to use or not allowed to use, and that type of thing. And it's really important in a sense for both the youth and the employers to really have that awareness and that these restrictions are there for their protection because, you know, the NIOSH that takes the data on workers' health and safety across the country have noted that young people under 25 are twice as likely to get injured as people over 25. Mm-hmm. So they're really there for a reason, you know, these restrictions. And so by working through that material, we can kind of introduce it. I'm not sure if I got off track too much.
No, actually, that's a good point that I wanted to bring up with Jeanette. The Trump administration, Jeanette, is actually currently looking at easing a handful of specific regulations. One, for example, is a hazardous occupations order that protects 16 and 17-year-olds from receiving extended training in jobs such as roofing work and using power equipment. And the federal law currently says it's too dangerous for those people under 18, but what happens if that work order is rescinded by the administration? Who protects those young workers? That goes away, doesn't it?
It does, actually. The legal protection goes away. I mean, hopefully the knowledge that was gained through the years of not allowing them employers will remember that and still not try to engage younger people in those more dangerous kinds of work. But in order to get one of those regulations in the first place, there has to be solid proof that NIOSH, which is the National Institute for Occupational Safety and Health, it's the research arm of OSHA, they determine over time that the injury rates are very, very high. We can look at the psychology of young people and notice that, you know, for example, in driving, we've been noticing that, you know, people under 25 have a difficult time doing this multitasking that, you know, is a part of their development. And we think that that's probably partly to explain why young workers do have difficulty with some of the more complex and dangerous machinery, right? They are perhaps more risk, they're more apt to take a risk than older workers. And so they, and for many other reasons we may not even understand yet. There could be a number of reasons we don't know why, but we do notice these really high injury rates, and when you think about how that cuts a young person down before they even get to their prime of life, that's a serious matter. And so, indeed, the Trump administration currently is easing this regulation, and I must say, any number, they are looking to roll back work that our colleagues have been doing for decades. And while we get distracted with media that may not have to do with this, their administration is effectively anything that doesn't require legislation in terms of a regulation, they're looking to roll back. And those protections were hard fought for. This is a good example of one, hard fought for with good evidence under it. And we're seeing this repeatedly, and it is highly problematic. There will not be the protections for the workers. And then, see, it takes a long time for that kind of regulation to get into our culture, to get all the way into the North Country, to get all the way into these cities and all the way permeating out. It takes a long time to be accepted, really, in reality, right? So a regulation is only a beginning step, really, up to promulgate a regulation or to finally get a regulation. People fight for them for a long time, and then it takes the cultural shift, like we're seeing with safe patient handling. We're finally seeing lifts being used, people going to seek help to take care of difficult situations inside hospitals. Those cultural shifts take a long time, so it's very upsetting to see this. And so there's two things to say about this. One is we need to push back and do the political work of not allowing these regulations to be tapped into so much. And that has been effective to some degree when we've pushed back. They tried to roll back a huge grant program that's really important to us, the Susan B. Harwood grant. And people were able to effectively mobilize, politically get them to not roll it back as much. So that is possible. That's a defensive posture. But I think for those of us who are planning to work in this field longer than today, seeing past the Trump administration even, we do have to think about positive, proactive ways to change the workplace hazards and conditions beyond just being defensive. So in other words, we just have to still keep advancing and finding new ways to advance workers' health and safety issues. And I just like to point that out because it's too easy to get into a reactive stance and just react to everything and spend all our time doing that when we need to actually decide what's important and move forward on those agendas.
So I have a question for you both, and Jeanette, you've addressed this a little bit earlier when you told the story about your son and the landscaping work that he was doing. What advice would you give to parents whose children are looking to enter the work world? What should they be thinking about as they guide their young people on these issues of health and safety? Because as we know, without experience, you're going to get in over your head really, really quickly in a lot of situations. And parents have the best interests of their children at heart, and they do have more experience. So how can they best be advocates for their kids and make sure that those workplace situations are as safe as possible?
Well, I think, Jeanette, you tapped into this a little earlier on how, parents usually encourage that narrative of you've got to, go out there, go the extra mile because, you want to impress your boss and things like that. Well, that's healthy to develop a sort of a positive, work habits. I think, young people will really listen to you and model after you. If you take health and safety seriously, you can work hard, but also be really taking care and knowing that, your health is of prime, importance. So model that for your children. You educate yourself on health and safety. Look at these materials that we're talking about and become aware yourself on what these restrictions are and what the hazards are. Ask your youth questions about things. Have them talk through their day and what happened. Oh, so then what did you say? What can you do about that? Talk them through situations. And I want to mention also that there is those materials are available online, the NYCOSH materials, so you can just look them up under NYCOSH. The other thing that we're doing besides the orientation is a full day long training, and that will allow a little bit of time to go to, or at least about 20 of the youth that are in the summer employment program. They will get paid to go to a full day training where they'll actually get to go through some of these, role play, some situations and understand. Because you have to kind of think ahead of time, what would I say if my manager or employer is asking me to do something that either is against regulation or that feels unsafe, like I don't think I got trained on how to use that, or I'm really not allowed to work after such and such a time, or I'm not supposed to be working alone, whatever it is. So what are you going to say? What are you going to do? Think ahead of time and work through it, and who you're going to call, if you need help with those kinds of things. And as a parent, you can make sure your child either gets into that or that they get that information and support, and show them you take it seriously,
right,
so that they will too.
That's good advice. Jeanette, what would you say?
Add to that, I echo all of that. The conversations every day, how to go today, what's up, when you were painting that, we're up on a ladder, what was it like, how, ask those kind of questions. Another thing that I found in my personal experience, and also when we see patients coming into the clinic, the question often is, when do we say we're quitting? When do we say we're not going to be in this situation? And I've had to walk through that with my own children. I've had to walk through, I've observed and talked to patients who are already sick now, and they've got to decide how much longer will they put their own health in peril. And it's a tough decision, but as a parent and as friends of other workers in the community, we need to be able to sit with people and say, when is my health more important than this job? And many times for a summer job, if the situation isn't really comfortable, it may be best to walk away from that job before your health is impacted for even a short time. And a youth's life and their development can be really, really bad. So I think that listening to them and helping them say, hey, you know what, I think that one kid one of my children the boss was frantic all the time, and he thought he probably was, on coffee or some kind of stimulant. The boss was always in a frantic mode and forcing the employees to work harder and faster and longer and come early and stay late, and it was just exhausting. And the questions around the table at night were, you might be able to find a better situation, actually. Look up to the positive of leaving a situation that is just unacceptable. And I think that if more people in general did that, and our youth certainly should be protected, consider whether working at the state fair is safe. Consider whether working in this machine shop just for a summer is really worth being exposed to those chemicals. And I think that once you have those conversations and look at all the options, protecting our health and the health of our young people would be paramount.
Yeah, and there are so many things that have long-term consequences. For example, exposure to noise. And you're not going to realize that until maybe years down the road. And yet, we see people all the time that have workplace injuries that were cumulative. And they did start very young, and they didn't know the right questions to ask. Educating ourselves about what our rights are is huge, and it's really difficult to do, isn't it? Because you got to know labor law, you got to know a lot of different things in order to really be able to do the kind of in-depth research you need to do about a field. So, and that's some of where things like your this little booklet, the Protect Your Health and Safety at Work. This would be good for young people as well as for older workers, right? So those are really important tools for students who are going into the work world, for young people, and for their parents. So, not to mention employers, because employers have no vested interest in hurting anybody and having that happen, and sometimes it's the lack of understanding about what responsibilities as well as rights are, isn't it?
True that.
Absolutely.
So, any final thoughts as we get ready to send these young folks off to work?
Well, I wanted to mention the
Oh,
number
go ahead.
people can call
Oh, sure.
if they want to sign up for the Summer Youth Employment Program, and there's also a website. So the number is 386-3276 in the 315 area code. And to get an application online, you can go to slconestop.com, and it's spelled out ONESTOP.com.
And that's the One Stop Career Center, which is
Right.
located right in Canton.
Yes.
So,
And they'll email you an application,
Right.
or you can get one.
right.
Yeah.
And so that's, and of course, that's just one of many places that young people can go to find summer work, isn't it? So,
Yes,
Lots of-
and employers
lots of
can
places.
also sign up to get
right, to get young people.
young people into your
Young people.
workplace. Exactly.
So most of the work that you do, Jeanette, is with older workers. It's not with real young people, but the habits that young people form in the workplace are going to carry on for 40 years at least, aren't
Right,
they?
and a lot of jobs have repetitive strain that
Mhm.
people really do harken back to. When I was 16, I was doing this lifting, and then a different job later adds to it, so people have this cumulative effect that you described. Also, I think that it's the habit of allowing someone to take advantage of us rather than asserting ourselves a bit in the situation that can be developed when a person is young. And I've run into plenty of people in their 20s who have actually decided they were going to challenge something or put in a wage and hour complaint or do something differently with their life because of their health. And when you see that kind of move, young people are often as we can see with all the people who are challenging the gun laws right now because their schools are so unsafe, the young people really have a capacity to look at the future that they want to build. And so I think that part of the empowerment process for all of us is to be able to speak out loud what our problems are in a coherent way. And so anytime that our programming can encourage that is an important move, I think. So.
It is, and I might remind folks that it is this crop of young people who are, if they register to vote and if they pay attention to local elections and state elections and national elections, will decide how this country is run, because they are the largest block of voters that are out there, and that is a power that has yet to be realized, and they can make a huge difference for all of us if they use that power for good, to improve working conditions and wages and everything else for everybody. So thank you both for coming in today. This has been a really important conversation. These conversations are a production of North Country Matters, which is filmed here in the Fred W. Cleveland Computer Center of the Potsdam Public Library. This show is a production of the St. Lawrence County League of Women Voters, the American Association of University Women of St. Lawrence County, and the Potsdam Public Library. They all contribute to North Country Matters. Until next time, remember, our North Country matters. Thanks so much.
Thank you.
Jeanette, thank you very much.